badge. Hello, hi. What about
Hi, I'm Danielle. I'm a student nurse, and I wholeheartedly support the junior doctors because they're fighting for each and every one of us in this country. They're fighting for their colleagues, they're fighting for patients. The only people that are risking patient safety are the Conservative government with their chronic underfunding and cuts to the NHS. There's been more operations cancelled by their underfunding than there has today, and each and every one of us has to get behind the junior doctors and support them before we lose the NHS forever.
Okay, hi.
Hello, Sam. I'm Sam and I'm a law student from North Yorkshire, and I'm completely against strikes. I think they're absolutely childish, pathetic, and they ought to go and get back to what they're good at and serve some people's lives instead of cancelling 110,000 appointments and 13,000 operations today. I think it's an absolute disgrace for the taxpayers of this country who rely on appointments every day, and they've been cancelled, and they probably won't get another appointment for another 6 months.
Well, we've got two striking junior doctors here. Do you want to accept that invitation? Do you want to go back to work right now?
We are at work right now. We are doing a very important duty, fulfilling a very important duty, which is protecting all of the patients in the NHS in the future. I don't think I so understand why people would be frightened today about this strike. My mum was in hospital on one of the strike days, and I fully trusted my colleagues to look after her, and they did. And what I would say is the thing that I am most afraid of as a patient and as a family member, my parents have been in hospital, they're also elderly and they rely on the NHS, is what is going to happen to our NHS if this toxic contract is imposed on all doctors from this August. That is my biggest worry, and that's what everybody needs to be frightened of the most.
The Health Secretary, Jeremy Hunt, he seems to be taking no notice of what you're doing, even this escalation. So what you're doing, according to the government, is not going to work.
I think that Jeremy Hunt needs to take a step back and listen to the voices of the public.
There is no sign that he's doing that.
I think that Jeremy Hunt will have to listen. He is the Secretary of State. His position is to listen to the public, to ensure that we have a health service that is able to support the public. He will have to listen to us. I do not believe that Jeremy Hunt truly wants the destruction of the NHS. I think that he needs to work with us.
This new contract will not destroy the NHS. That is completely over the top.
I think that this contract will be the steps towards the destruction of the NHS.
Let's hear a conversation between our members of the public. You'll have to gather in. Come on.
Just on the contrary to that, I don't think Jeremy Hunt is against the NHS whatsoever. The public are on the junior doctor's side for now, but when they realise that the dispute is all about money, it's nothing to do with patient safety. Patient safety, it's got to be about safety.
I'm not going to suffer a pay cut under this contract. Why am I on strike?
The amount of working hours, the maximum working hours under the current contract is 91 hours. Under the new contract, it's 72 hours. So if it was about patient safety, the junior doctors, your counterparts, would have
about the 72 hours.
The original
so
contract.
At the moment, as things stand, on a yearly basis, our trusts have to make sure that we work to the amount of hours, a maximum number of hours. The government in this new contract will be removing those safety guidances that keep us safe, but also keep the patient safe. So you're saying that there's going to be a 72-hour cap. How do we know? How does anyone know that there will be the 72 hours?
You're saying that's a technical point.
It is a very technical point, so I'm not sure.
Not for a junior doctor who works many hours and is worried about.
Well, the mechanism, I'm sure, could be refined. What they're essentially saying is you don't agree, and it must be technically right in every detail before we go any further ahead. I'd like to get back to the 7-day thing, because the 7-day thing has been consistently misrepresented by the junior doctors who say, we provide a 7-day emergency service. Well, that's not what it's about, and it's not either about elective services 7 days a week. In the 7-day, in the 5-year forward view, in Simon Stevens' vision of how the NHS could continue, which was not a political vision, was the 5-year forward view said, let us provide 7 days a week services where they're required, where they're clinically required. Okay. And that's what the 7-day thing is about.
That's what it says in the 5-day forward, is to get rid of the doctors, completely change our health service and privatise it. And actually, how can you provide it?
Get rid of the doctors.
It's true, read it. And another thing, how can you provide a 7-day service if you're chronically underfunding the system?
Come on, or else.
Could I just say, People say we don't have a 24/7 NHS. We have a 24/7 NHS when it really matters. I personally have had to go into hospital for life or death situations. I've called my nurses, I've called the emergency contact numbers that I have, and I've been seen as quickly as humanly possible. We have a 24/7 NHS when it really matters,
That's
when
great,
it's life
and
or death.
that's great.
And I
That's
do
how it
not
should be,
think
that's
that
how it
we
should
should
be.
be. I do not think that we should be fed a fallacy that we don't already have a 24/7 NHS. I was going to say, my experience of 7-day service wasn't quite as good as that, unfortunately. My mother-in-law died of cancer 2 years ago through a series of errors, mainly waiting far too long to be diagnosed. When she did get the diagnosis, the surgery did not go according to plan, as we've been told, and the aftercare was appalling. And when she fell ill on the weekend, often the weekend shifts, the staff themselves told me, try not to bring in on a Saturday, we call it the graveyard shift. And some of the care that she got from registrars and other doctors who were on at the weekend was not the same standard and the same level to how it had been during the week. We didn't have handover properly, the briefings weren't done properly. And we're in a day and age where we need 7-day care, and no one's disputing you should be paid to do that.
That's all right. My name's Ruhi. I'm a cancer specialist. I'm a junior doctor. I've been a junior doctor for 10 years. And I completely understand the concerns that people have about weekend care and how we can go about improving the function of the NHS, but we need more doctors to do that. We need more doctors on shifts, every shift, to provide the care, not just from an elective point of view, because the government hasn't even told us what it means by 7-day service. Is it talking about an emergency? But we're not talking about the Simon Stevens 5-year forward view. We're talking about the government manifesto of 7-day services.
Can I ask you? Almost all junior doctors I speak to say this is not about Saturday pay. The government is offering extra pay after 5 p.m. on a Saturday. The BMA wants everyone who works all day Saturday to be paid at 50% above the basic rate. It's disingenuous to say it's not partly about Saturday pay, isn't it?